Welcome to the Pharmacist Voice Podcast, episode 230. I'm the host, Kim Newlove. Cory Jenks, PharmD, is on the show today to talk about his book, Permission to Care, Building a Healthcare Culture That Thrives in Chaos. This is episode 10 of 15 in my Pharmacist Authors Summer Series. Links to the first 9 episodes in the series are in the show notes, which you can find on thepharmacistvoice.com. Just click on the podcast tab and find episode 230. Who is this Cory Jenks fellow, you may be wondering? Cory Jenks is a pharmacist. He earned his Doctor of Pharmacy degree from the University of South Carolina in 2011. Since then, he has practiced as a retail pharmacist, outpatient clinical pharmacist, and inpatient clinical pharmacist. He currently is a practicing clinical pharmacist and improv comedian. Cory travels the country teaching healthcare professionals how to apply the valuable skills of improv comedy to create a more adaptable, empathetic, and humanizing healthcare experience for both patients and providers. Cory lives in Tucson, Arizona with his wife Cassie, their 3 children, and 10 chickens. Cory was also my guest on episode 89 of this podcast. If you're new to the Pharmacist Voice podcast, thanks for tuning in today. Again, I'm Kim Newlove, the host. I'm a pharmacist by training, but I'm not in clinical practice anymore. I am a voice actor and a podcast host. I graduated from the University of Toledo College of Pharmacy with my BS Pharm in 2001. Among other things, I narrate audiobooks for pharmacists. If you have a project in mind, whether it's an audiobook, medical narration project, or something podcast related, contact me through my website, thepharmacistvoice.com. Without further ado, here's my conversation with Dr. Cory Jenks. Hi, Cory. Welcome back to the Pharmacist Voice podcast. How are you?
I'm doing dandy, and yourself?
I'm awesome. It is always fun talking to you. I am happy to have you back here on the show.
Well, thank you. I'm honored to be a multiple-time guest on the podcast.
And I've talked about you on this podcast when you haven't even been a guest.
I thought my ears were burning.
Yeah.
That must be why. So
It was after we saw each other at the Ohio Pharmacists Association annual meeting last year, which would have been 2022. I talked about you in episode 143.
Mm-hmm.
So, yep.
All right.
Your ears might be burning throughout time because people play that one, even though it's been in the past.
I weirdly had an adult ear infection last October, and it might have actually been just people talking about me from your podcast. So
it's all my fault.
Either way, my ear feels better now, and I'm ready to listen to you with both healthy ears and have a fun time this morning.
Awesome. Well, thanks for being here to talk about your book today. We're going to talk about Permission to Care by Cory Jenks. I'm excited.
Yeah, well, thank you for having me on to talk about it.
No problem. Well, what's the book about?
So the basic premise of the book is a kind of like compilation of my experiences as a pharmacist and as an improv comedian, and how I have taken those lessons as an improviser and applied them to healthcare, and how you, the reader, can take those lessons and apply them to your career in healthcare. And I think that beyond that, I have had non-healthcare people read this book and say, oh, these are really good lessons for life or my other jobs. So it really are, they're universal lessons, but I apply them specifically to that frontline healthcare worker and that healthcare leader as well.
Now, what inspired you to write this book?
I think that I had been doing improv at the time I wrote it for about 7 or 8 years, and had really seen a shift in my relationship with my patients and really my relationship with the practice of pharmacy. It became a much more enjoyable, a lot more flow in conversations with my patients. And I realized, it was these skills of improvisation that have helped transform my relationship with healthcare. And I would like to help others do that too. And it sort of coincided with an embarkation on a speaking career where I go to places like the Ohio Pharmacy Association and give talks about it. And 2020 was going to be my year to go and do lots of talks, and then COVID happened. And so it was, something I talk about in the book. There's no mistakes, there's only gifts. So I would never call COVID a gift, but the gift of being stuck at home gave me the opportunity to take a lot of these ideas I've been jotting down, put them on the page, and just write like crazy. Really, from March to June of 2020, my goal was to get it all on paper before my second son was born, and I hit that goal.
Congrats, you did it.
Yes.
This book is funny. I mean, I laughed out loud when I read it. I think just the way that I believe you talk about your grandpa's nickname for you, if I remember right, that made me laugh.
It's a little PG-13 for the listeners in case you're listening with little ones in the
Yeah.
car. But I was known as his little S. To take away, we'll take a four-letter word and turn it into a one-letter word, and you can use your imagination what he used to call me. But it was a term of endearment, if you can believe that.
Yeah. Oh, I believe it. I believe it. Yep. I've known people who, yeah, can make a term of endearment out of something that's not usually a term of endearment. And that's all right. That's all about improv. You know, you just say yes to it. Yes. And I'm your grandson.
Yeah, it's like you've read my book and heard that
Yes.
phrase like 1,000 times in it. So
Yes. Oh my gosh. I think at the end you said one of your goals was to set a record for saying yes and. Is that right?
I think so, and no one has tested me against any other books. So we'll just assume that I'm the champion of yes and I'll take my big fat check from Guinness at some point. Uh,
Awesome. Awesome. Now, for anybody who's new to improv and including improv in healthcare, I mean, what's the connection?
Yeah, I get a lot of weird looks when I say that I connect improv comedy to healthcare, and I think that's fair. Improv is sort of an abstract concept. Maybe some people's introduction to it has been watching it at Whose Line Is It Anyway? Maybe you've been to an improv show. And when I say I'm a comedian, I do improv comedy and I apply it to healthcare, people just assume I'm just like, oh, you're telling jokes to patients all day long. And sometimes that is the case, but really improv, to be successful as an improviser, requires a lot of listening, communication, empathy. What you have coined it better than I did after thousands of words in a book was to make others feel seen, heard, and understood. And if you are a successful improviser, you are making your scene partners feel seen, heard, and understood. And you're really connecting with an audience in a way where they feel seen, heard, and understood. So when you can live in the moment, and improv, a lot of people think too, like, oh, I have to come up with jokes. Like improv really is simply listening and responding in the moment. And if you are having a successful healthcare interaction, you are listening and responding in the moment. And unfortunately, I think it's a skill that a lot of pharmacists, nurses, doctors, anyone who works in healthcare, very smart people, not disparaging them, but it's a skill that we don't really focus on learning and a muscle we don't really build much.
Permission to care is such a great introduction to just an expansion of what you just said, using improv for healthcare to engage people where they're at and make them feel seen, heard, and understood. It's all about empathy. I just love what you do.
Well, thank you. And I think that a lot of improvisation is letting go of control. And I think in healthcare, we like to control everything. And one of the things we don't often get to control, and I talk about some of the experiences with family members here, is the outcomes that we have in healthcare. And unfortunately, that is just the nature of life. We control so little, but we can control the experience we provide for our patients. And so I had an experience just this past week in my day job. I, I'm not successful enough as an author and comedian to have quit pharmacy altogether, so I still work and practice as an ambulatory care pharmacist. And I had a challenging patient. I don't need to go into the specifics. I manage a lot of type 2 diabetes. They've been struggling for years, and they left and they just said, thank you for listening. And it's like, okay, well, I don't know if I'm going to reverse your diabetes today, but I've made that connection. Hopefully they will heed what I had discussed with them. And when they come back in a month, they'll be a little bit better because they were willing to listen to me and I was willing to listen to them.
Yeah, what a great way to build a relationship, helping them to feel heard, and then you get that trust in return. This is great. I would love to talk about improv all day because I have taken classes before and I think it's fun. And your unique take on it is, of course, in the book, but it's definitely out there for your audience to learn. So, who is your audience?
Who is my audience? So I think that anybody who is a frontline healthcare worker, doctor, physician, physician's assistant, nurse, nurse assistant, medical assistant, anyone who's interacting in the healthcare system could benefit from some of the lessons that I give you in the book. There are some links to videos where you can actually practice some of these activities yourself, build that muscle. People think I'm not funny, I can't think on my feet. This really is, I have taken people in improv classes that are afraid of getting in front of people and they now teach improv classes. It really is a muscle you can build. So that frontline healthcare worker, you will improve. And what I love is that I've had people read this book and they said, I went and I used this concept of yes and the day I read it and it improved my experience. So there are like the tactical hands-on things you can do. Now, the subtitle to my book is Building a Healthcare Culture That Thrives in Chaos. So the culture builders of healthcare are healthcare leaders. And so I really wanted to emphasize that connection to leadership in this book as well. So if you are a frontline worker or you work in healthcare administration, I think this book is an excellent read for you, just in sort of building a better culture for your employees. So we're going to create a better experience for our patients, for that frontline worker. We're going to create a better experience for the people that we lead if we're a leader of healthcare. And then beyond that, like my mother is a retired teacher. She read it and she's like, first off, she said a very high praise. She said, "Wow, it was actually good." And I was like, "Thank you." It was
What?
actually like, I don't know if she thought it was going to be terrible, but whatever. I love you, Mom. She's not going to listen to this, so it's okay.
That's all right. My
But
mom's a retired English teacher, and I think to this day, she still reads my Christmas letter with a red pen in her
yeah,
hand. I
that
think.
is,
Just guessing.
I don't doubt it. They can't turn that off. So,
Yeah.
but the other thing she said was, "Wow, I could have used this as a teacher." I'm like, yeah, and I think improvisation is like a universal skill that any of us could take in any aspect of life. Like I've had a nurse practitioner, a friend of mine who read the book and it's like, I use that yes and thing with my family and it went good. And I'm like, yeah, it's something that, like, listening is good for like relationships outside of work too. So if you could believe that. So like the primary audience is healthcare, but I think that if you're looking for a fun, light, fairly quick and easy read that you're going to enjoy, laugh out loud a bit at, and take some tangible skills and tools away from, anyone looking for an afternoon of reading can enjoy this book as well.
Absolutely. And if I may be so bold as to suggest, read it with a pen or a pencil and write in the book, because there's some cool stuff that I've circled in here, and I'll look back at it and just smile because I remember reading it and it was funny. It made me smile and I can use it.
That's actually, that is some of the highest praise I can get. If someone says, I read this book, it made me laugh, it made me smile. First, as a comedian, it makes my ego get a little bit bigger. I'm like, it's a proof of concept. Like, I call myself a comedian, but sometimes I'll say to people at work, like, "Oh, in my free time, I'm a comedian," and they kind of look at me like, "Oh, you are?" I'm like, I guess not. If I'm not making you laugh day to day. But to hear that you laugh, but then you also said, I could use this book too. Like, I don't want this to just be words on the page. I want this to be something that will improve your life, both from I laughed a little bit and I used it as well.
Absolutely. Now, at this time, I would like to invite you to read an excerpt from the book. I know that you have not made the audiobook, so this is a special treat for anybody who's either read the book or is thinking about reading the book. I give you Cory Jenks.
Well, thank you. Yeah, and I have not recorded the audio version of this yet. I'm sorry to all the people who love Audible. It's like I would read it if I could listen to it. It's a lot of work to write a book, and it's a lot of work to record a book too. So I will work on that as a goal in 2023 as I record this. So the excerpt I'm reading is from chapter 5. It's entitled "Honesty." The subtitle is "Not Just for Politicians." So a little fun joke there, and then it is the subheading here is "When it comes to healthcare and football, I am tired of punting, and so are our patients." So here we go. Grounding our healthcare in a place of reality with our patients is another way to keep them engaged. The term punt is common in healthcare, with patients being punted or sent to multiple different appointments and specialties only to be punted or sent back to a different one with no real progress being made or improvements in the patient's condition. This back and forth leaves patients frustrated and disengaged. It reminds me of a dear patient of mine whom I have followed for their blood sugar. They are someone we in healthcare might call a high utilizer and who requires a lot of extra TLC. For this patient, it meant a nearly endless list of problems, conditions, and near and dear to my heart, medication allergies. While the focus with this patient was supposed to be on their diabetes, our appointments inevitably became a long discussion about the medications they needed, were missing, or that were causing them problems. On one particular occasion, they brought up their concern that their new heartburn medication was no longer effective. The this is a heavy dose of sarcasm, obvious reason was that the color had changed on the capsule. A change in the contract for the preferred generic manufacturer, something well beyond my control, was to blame for the change in appearance. They had been receiving the different colored pill for a few months, and I had noticed their heartburn had worsened. I am not here to debate if this was truly due to the new brand of pill being less potent. I am an improviser and say yes and accept reality. That this new pill wasn't working was my patient's reality. To complicate the situation, they had been admitted to the hospital within the previous few weeks and had received their old style of heartburn medication. For some reason, our inpatient pharmacy had not gotten the fresh new generic manufactured pill. The good news is that when they were in the hospital, their heartburn was controlled. The bad news is that they now thought our organization had their preferred pill and that we should easily be able to supply it. Unfortunately, this was not the truth, and they had already spoken to their provider, who had spoken, according to my patient, with someone in our outpatient pharmacy who said it would be able to supply their brand. It was no secret amongst pharmacy staff that we were at the whims of national contracts for generic medications, and the decision as to which manufacturer was used was far beyond all of our pay grades, and that it was simply impossible to promise a particular looking pill. Now, my patient, with the assurance of their provider, was under the impression that we could get their specific pill and fix their heartburn, and was on the phone with me asking why they still had heartburn and didn't have their preferred pill. As much as it hurt, it was time for someone to be honest with them, and that someone, as you may have guessed, was me. I listened intently to their story, expressed a shared frustration over the miscommunication that we could get their specific pill, then I gave them the straight truth. We cannot get your specific pill. The decision for what we get is made on a national level and is totally beyond our control. I am sorry you were told otherwise, but we need to figure out a solution for you, which may mean an alternative medication. Rather than use your imagination, I will tell you that they were less than pleased. Yet they were also grateful I had been honest with them. The story does have a happy ending, though. Since the patient realized our organization did not have the power to fix the pill problem, they got to work solving it themselves. They researched what manufacturer they had been using when it was effective and made calls to other pharmacies until they found one that had the brand they wanted. Then they let me and their provider know what pharmacy had it, and their provider was able to call in their prescription. Problem solved. No more heartburn. The patient's heartburn symptoms presumably improved as well. This is just one example of how we can utilize the improv tenet of honesty to engage our patients and solve their problems. Or in this case, get the patient to help them solve the problem for themselves.
And scene.
In death, yes, and scene, yes.
Thank you for sharing that. I appreciate that.
Oh, sure. Yeah.
Would you like to comment on the selection that you read, maybe why you read it and why it's important to the audience?
I think that I chose it for a couple of reasons. This was one of my most memorable patients that actually my wife had also taken care of, and also had commented on the fact that she and I were the only ones who listened to them. But I chose it because honesty is often hard in healthcare. We don't like to tell people bad news, and I think that one of the biggest frustrations we get. We talk about the experience. You know, I have family members who have multiple conditions that get punted from one specialty to another. Never get a straight answer. Never get someone that will sit down with them, because I think as providers we're afraid of what patients will say when we tell them the truth. So in this case, I really like to highlight this because by telling them the truth, they realized what the situation was, and they actually took ownership of the problem themselves and figured out how to fix it. And so I think that's a powerful reality of, when we accept what is, like I can't get the medicine they want. We were honest with the patient instead of just giving them the runaround while they're suffering with their heartburn. And then they solve it themselves and they feel more empowered. So it was a really powerful example for me.
Awesome. I love to hear patients solving their own problems too.
Yes, indeed. We're really busy as pharmacists. So when patients, and then they learn they can, again, not trying to skirt my responsibilities as a pharmacist, but this is, whenever a patient can take care of things themselves and feel that ownership and feel that excitement and pride of doing it, I'm all for it.
I'm one of those people who thinks ability first, and I like to see other people doing that too. My
Mm-hmm.
pharmacist isn't able to do it. He told me the truth. What can I do? So,
Right.
great example. Thanks again for reading that.
Sure.
Now, Cory, we already talked a little bit about why people should read it, but would you like to add anything to what you talked about earlier?
I think that this is a book that, while healthcare is a very complex issue, there's a lot of problems in it. There's how do we pay for it? How do we administer it the best way? Those are books to be written by another author who has different expertise. But I think we talk just about that patient who took ownership of what they could do to make their situation better. And I think a lot of us in healthcare have had this learned helplessness drilled into us. And we feel so much of if we are in a situation that isn't ideal, how much of that is beyond our control. I think that if you read this book as a frontline healthcare worker, you're going to learn to take a little bit more control of your situation. You're going to learn some agency, learn some tools that, while we can't change the world we live in, the waters we swim in sometimes, we can improve that day-to-day situation, the interactions with our coworkers and our patients, and we'll be happier. I can't promise like healthcare utopia, but if we can make a terrible situation a little less terrible and make yourself a little happier, that's great. And then for those healthcare leaders who are struggling to build that culture, like, if what you've been trying ain't working, take a look at this book, because I think there's some novel ideas. They might come across as overly simplistic, but having the means and the ways of administering them in a fun, pragmatic way is something you'll get out of this book as well.
What's the number one thing that you want people to get out of reading this book?
The number one thing I want people to get out of reading this book, that's tough because a different person is going to get different things out of it. But I think if I could get one thing from everyone reading this book would be to be better listeners to the people around them. Uh, and I mean, this goes from if you go to the restaurant and they mess up your order because they weren't paying attention, you are on customer service and they won't listen to you because they haven't listened to your problem. I think that creates poor listening creates so many problems both in healthcare and beyond it. And so many mistakes that are made in healthcare isn't because it was like a complex patient or this or that. It's because we have a miscommunication. So if we can read this book and learn some skills to be better communicators, we're going to solve a lot more problems. We're going to get ahead of so many problems that will be coming down the road in the future.
I love that. Be a better listener.
Yeah, it's
Awesome.
simple, but if it was easy, we'd all be doing it, and I wouldn't have had to write this book. So
Well, you already talked a little bit about some people taking an improv class and then they end up teaching it or something, and or maybe the book audience will get inspired and want to do other things. So I just wanted to ask, what's the number one thing you want them to do with the information?
what do I want them to do with this information? I challenge you, if you read this book, to go out and be more willing to say yes to things. So I think our healthcare system, our life is our default is no. And when I took an improv class the first time, I went from that world of healthcare where everything was no, and the rule was I had to say yes, and it was like this beautiful light I look forward to every week. The weight's lifted off your shoulders. You're not like scared of what to ask or what to do. So be willing to say yes to more things that come your way, even if the opportunity is something that scares you, even if it's a family member that might be a little bit annoying that you're going to go visit with your in-laws or something like that. I'm not going to say anything specifically like that. Not that I would speak from experience, but if we can say yes a little bit more, I think that we're going to have a little bit brighter life. The world will open up, and my goodness, saying yes to an improv class 10 years ago has set me down a path I would have never imagined, in a good way. Like you could be like, I can't believe I went this. No, like this has been a joyous path that's unfolding every day in ways I couldn't have imagined or believed, and it's been a ton of fun. And I challenge you, the condition to say no healthcare worker who will read this book and say yes more, see what saying yes in your life will lead to.
Excellent advice. Thank you for sharing that.
Of course.
Now, Cory, where can my audience find your book?
Well, I know it's on this little tiny book site called Amazon. You might be able to find it there. So Amazon has it. Barnes and Noble has it on their website as well. But yeah, I mean Amazon dominates the world, and they make it easy to buy stuff. So if you go there, you'll be able to find it. If you can link, there might be a link in the description of the show. You could go right there and get it. If you read it and love it, as a first-time author, I ask that you review it. You can even reach out to me. You can go to my website, coryjenks.com. And then from there, you can find me on all the different social medias. And if you love it, tell me. If you hate it, tell me too. I need feedback, both good and bad. So I would be honored if you spent some time and money reading it and letting me know what you think.
I will definitely put links in the show notes. And are you going anywhere doing a speaking opportunity? I imagine you'll be selling the books there too, right?
Yeah, a lot of the places I go speak will have the books for sale as well, and I will autograph it for you, just like I autographed Kim's book last year in
Yes,
person.
indeed.
So
I won't tell anybody what it says, but it is autographed and we got a picture together and I really enjoyed that moment. It was a pleasure meeting you.
oh, it's always special meeting people in person. You know, we spent several years on Zoom, meeting people virtually, and then to get back in person was a treat. And then when I get to meet people who've read my book, who've enjoyed it, to be able to put that personalized touch on the book means a ton as well.
Awesome. Well, Cory, as we wrap this up, is there anything else you'd like to share?
I think you got everything out of me. We talked about who the book's for, what it's about. I read an excerpt from it. I pitched it. I short of spending another more morning's length of time talking about the intricacies and the application of improv comedy. I want to respect your and your readers' time and thank you and them for having me on and sharing some time together.
All right. Thanks again, Cory, for coming back to the Pharmacist Voice podcast. Take care.
All right.
Great interview. Thanks again to Dr. Cory Jenks for being my guest on the Pharmacist Voice podcast. I hope that Cory has inspired you to use the principles of improv comedy in healthcare. And if you're interested in writing a book, I hope that Cory's inspired you to write about something that you're passionate about too, whether it's in the world of pharmacy or outside the world of pharmacy. Cory's a great example of someone who brings something beneficial from outside the world of pharmacy into the world of pharmacy so we can all learn from him and maybe use what he has learned too. When used in a constructive way, improv comedy changes the way that we feel about our work and it builds relationships with everyone that we come into contact with, especially patients. I'm going to take just a minute to explain my experience with improv comedy. I have taken a couple of improv comedy classes as part of my voiceover industry training. So, as I became an audiobook narrator and a medical narrator, I ended up taking some improv classes. It was not something that I had planned on doing when I went into voiceover, but I'm glad that I took the classes. And I can tell you that when Cory talked during our interview about giving up control and how hard that is, I have to agree. Giving up control at first was hard. I still struggle with it. But practicing improv with a group of strangers from different backgrounds is one of the most fun things that I have ever done in my whole entire life. I laughed great big belly laughs every class, during every class. Improv class is like playing games with other grown-ups. And the language, by the way, is kind of R-rated. So if you take an improv class, prepare yourself. These were fun games, though. And I must say that we had scenes where the teacher would tell us what was going on, and we would have to act out the scene. And I messed up scenes in class. I got over it pretty quick, but there's always this desire to have control and make sure it goes perfectly. But I learned from my mistakes, messing up scenes during class, and you can too. Every class I take, every improv class that I take is different because there are different people in it, different teachers, and they ask different things. And I have to learn how to work with all of them. And in a lot of ways, this mirrors life. I'm sure Cory would agree if he was part of this monologue as I wrap this up. Here's the thing, as pharmacists, we have to work with all kinds of healthcare providers and patients in the course of doing business. We get a mixed bag of both kinds, right? Patients and providers. I challenge you to take an improv class at a studio that's local to you in 2023. Put it on your goals list for this year, your professional goals list. So take that class, then apply what you've learned to your job and read Permission to Care. It'll bring everything together for you, theory and practice. Before I wrap this up, I promise I'm almost done. I want to tell just one more story. Here it is. Cory and I have actually met in person. In April of 2022, we met at the annual conference of the Ohio Pharmacists Association in Columbus, Ohio. We like to call this OPA. Now, that's where he signed my copy of Permission to Care, his book, Permission to Care. And in case you are wondering why Cory, who lives in Arizona, was in Ohio, he spoke at the conference. And I talked about this in a previous episode, episode 143, I believe. So, Cory spoke at the annual conference of the Ohio Pharmacists Association, and his session was about using improv comedy in healthcare, which is what Permission to Care is all about. It was by far the most fun CE I have ever attended, ever. It was so fun. Now, if you know of a conference that Cory should speak at, something that you're going to attend, please nominate him as a speaker. You will laugh and learn. I know I did. All right, story time's over. Let's wrap this up. Thank you for listening to episode 230 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to read the show notes. In the show notes, you'll find a link to Permission to Care, that's on Amazon.com, Cory's website, his social media links, a list of pharmacist authors in this Pharmacist Authors Series, my social media links, and more. If you know someone who might like this episode, please share it with them. And if you like this podcast, please subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. I'll be back on Friday, July 14th with my interview with Dr. Donna Bartlett, PharmD. We'll be talking about her book, MedStrong, Shed Your Meds for a Better, Healthier You. Thanks for listening today. I'll talk to you on Friday. Hey, thanks for sticking around. This is the bonus or an Easter egg, some people might call it. Just in case you're into audio production, I want to let you know what happened. I recorded the introduction and the closing of this episode on the road while I was out of town. I'm not in my usual recording space. And somewhere between the introduction and the closing, my microphone broke. So I used the principles of improv and I said, yes, and I will get this episode done no matter what. And it had a happy ending. I know I sounded a little breathy in the closing here, and I probably sound more nasally, but hey, it's me. It's the same person. I said yes, and I'm putting this episode out there, even though it is not with the same microphone I started with. Sometimes you just have to say yes and with podcasting. Thanks for sticking around. I'll talk to you on Friday.